Ladies and gentlemen, building the national standard on health in the commune level is a condition for the comprehensive development of grassroots healthcare, improving the quality of medical examination and treatment for the people, and is also an important criterion on building a new style rural area. Over the last year, the TayNinhTV province has paid attention and effectively implemented the national set of criteria for commune health in localities. With a synchronous investment in material facilities, equipment, and human resources, it has created conditions for people to access quality health services in the localities.
Determining the grassroots healthcare level is the closest one to the people and serves the majority of people. In recent times, TayNinhTV province has focused and prioritized investment to create a comprehensive transformation in organization, human resources, finance, material facilities, equipment and operational mechanism of health stations in communes, wards and towns. Up to now, 100% of communes, wards and towns in the province have met the national criterion on health. This result contributes to create conditions for the grassroots health sector to develop comprehensively and effectively implement national programs and projects on health as well as epidemic prevention and control. Thereby, it improves the quality of medical examination, treatment, and healthcare for the people. With the attention of the provincial and district authorities, in 2016, Phước Ninh Commune was recognized to complete the new rural construction. In the implementation of 19 criteria, the criterion number 15 on healthcare has also been invested by superiors in the material facilities as well as medical equipment. After 5 years of implementation, up to now, the healthcare for people in the locality has been basically guaranteed, minimizing the need of referral for medical examination and treatment. People also believe in local management of health. Their health insurance is also basically accepted by the people. The commune continues to direct the health station to advise well this matter, how to ensure good health of the people in the coming time. The Khmer Health Station has been invested in construction, ensuring on items including the works since the beginning of 2012, so the facilities are now guaranteed. The medical tools and instruments also basically ensure the service of medical examination and treatment for the people. With the available facilities, equipment, and human resources, the commune health stations in the province have well taken care of the medical examination, treatment, and care of people's health. In the epidemic prevention control, the preventive healthcare system from the district to the grassroots has been strengthened, capable of monitoring disease detection, health communications, and education for the people, in which the medical centers of districts, towns, and cities manage and operate commune and town health stations to perform their functions and tasks of frontline healthcare. Every year, the health centers of districts, towns, and cities actually plan and implement epidemic prevention and control activities, especially diseases that are at risk of becoming a major epidemic in the community. The infectious cases are well monitored without occurring major epidemic. The management and assurance of food hygiene and safety at all levels are concerned. Annually, the rate of children in the age group who are fully vaccinated is over 98%. The tetanus vaccination for pregnant women is over 98%. Commune and town health stations will perform frontline medical functions and tasks. In fact, thanks to the care, consolidation, and development of the health network and the training for grassroots health staff, the healthcare work for people in the province has achieved many important results. Healthcare services have been brought closer to the people, so they are examined and treated by health insurance at commune health stations in order to meet the increasing healthcare needs of the people. The grassroots have actually studied to improve their qualifications, actually master technology in order to well perform their assigned tasks. It is noteworthy that the grassroots health level in the province has well implemented the health management and monitoring for policy beneficiaries, children under 6 years old, and those participating in health insurance. Most of facilities are also equipped by the district and Department of Health for the station to ensure the initial medical examination and treatment at the grassroots level. However, the health station does not have a doctor, so ultrasound is not available, mainly for medical examination and treatment for patients with health insurance. For common diseases, but for the severe diseases, we ask for referral. Despite of the complicated situation of the COVID-19 epidemic, it ensures the medical examination and treatment. At the same time, provides health insurance drugs for people to ensure primary health care for everyone. In the current time, in addition to constantly improving the quality of medical examination and treatment and first aid healthcare for the people, the main task which is given priority by the health stations of communes, wards and towns in the province is the prevention and control of the COVID-19 epidemic, with the direct guidance of the medical centers of the districts, towns and cities. The epidemic prevention and control activities at health stations of communes, wards and towns have been deployed proactively and decisively in addition to successfully completing professional plans and tasks. Facing the unpredictable developments of the COVID-19 epidemic, the medical staff at the grassroots level still follow the locality every day, hour by hour, increasingly promoting their role with the motto going every alley, knocking every door, tracking each object, supervise and investigate the epidemiology of subjects coming from the epidemic health areas to take timely measures and prevent disease better. Implement the expansion of vaccination for the people in order to achieve community immunity soon. Especially TayNinhTV province is now implementing medical isolation and treating COVID-19 patients at home. The medical teams at the grassroots have actually supported people in treating the disease. Currently, the health station is also equipped with 4 computers and SP oxygen machines. Breathing oxygen machines are also supported to treat F0 cases at home. When there are F0 cases being treated at home, their mobile medical team will come to their house to check the health, to report to the superiors for timely direction to avoid severe cases. Currently, the grassroots health system is still quite short of doctors. Not all health stations have adequate doctors, but they can be sent from the health center. This problem also affects quite a lot to care and monitor patients. However, for the F0 cases, we have also trained quite carefully for those from intermediate level and above. For example, the physicians at the station also grasp the relatively basic problem to follow, monitor and promptly handle F0 cases when problems occur. Therefore, although the team is still lacking and the work is very overloaded, the grassroots healthcare level can basically meet the current needs. Although many important results have been achieved in building a grassroots health system that meets the standards of the Ministry of Health, the problem for the health sector of the TayNinhTV province, as well as other localities, is to continuously maintain and improve the achieved results. with the goal of striving for 100% of commutes, works and towns to meet the national set of health criteria in order to constantly improve the quality of primary health care for the entire population. The health sector needs to continuously coordinate with the authorities. The localities gather resources, step by step implement the criteria in commutes that have not yet met the prescribed standards, promptly remove difficulties and obstacles for units in the implementation process, to step up the socialization of medical activities, to create resources to invest in building material facilities and equipment for medical stations, to step up the training of human resources for the commune level, strengthen the inspection and supervision of the construction of commutes, meeting the national set of health criteria, summarize, evaluate, and raw experience in the construction of commutes, meeting the national set of health criteria in localities.
Ladies and gentlemen, in order to continuously implement the health criteria sustainably in new style rural construction, in addition to continuous investing in infrastructure and equipment for commune health stations, meeting the national set of criteria, the party committee and authorities of localities should make efforts to propagate and mobilize people to actively participate in health insurance. The health sector continues to strengthen the medical examination and treatment network at the grassroots level, regularly foster and improve professional qualifications and ethical qualities for medical staff, improving the quality of medical examination and treatment, ensuring the interests of health insurance participants, creating trust among the people as participating in medical examination and treatment at commune health stations. That's all for today's programs. Thanks for watching and see you next time.